Ladies and gentlemen, happy Ramadan. We are going to talk today about a disease which has been found in the last 20 years. This is actually AIDS. AIDS is a disease which stands for the initials of acquired immune deficiency syndrome. And it's caused by a virus called HIV, human immune deficiency virus. AIDS right now is a global disease. No single country did not report cases of AIDS. Every day there are about 16,000 new cases of AIDS. That means that every 6 seconds there is a person all over the world who get infected by the HIV virus. So it's very important to talk about AIDS and how it's transmitted. In the month of Ramadan, we have to talk about how to prevent AIDS and the condition of the AIDS patient or carrier, if he can fast or not. First, the modes of transmission of AIDS are well known right now. It's transmitted through sexual intercourse, either homosexual intercourse or heterosexual intercourse. Number two, through sharing needles or scalpels or any acute bladed instruments like the dental instruments, if it doesn't, if it has not been sterilized well before using from a patient or a carrier to a healthy person. Number three, of course, transferring blood or blood components or blood derivatives like RBCs or hemophilia factors or something like that from a carrier or a patient to a normal person. The last thing, which is transmitting HIV infection or AIDS, is from the mother to its newborn or to the infant in 5 to 15% of the cases. And now we have actually some medications which reduce this percentage and which can give rise to a healthy baby without any manifestations of AIDS. Now we are talking about AIDS. If we are talking about AIDS itself, AIDS means the blowing of AIDS manifestations is manifested by around 25 manifestations. Any of the 25 manifestations could denote the presence of AIDS. When I can consider the AIDS carrier a patient, these includes 25 characteristics, including a lot of things, either the opportunistic infections, which appears maybe pneumocystis carinii in the lung, maybe diarrhea, chronic diarrhea for more than 2 or 3 months, which doesn't respond to any treatment, disseminated candidiasis in the gastrointestinal tract. We find ulcers in the mouth and all over the GIT, and of course these manifestations are a lot, and it has to be diagnosed by the physician. The physician should put AIDS among his differential diagnosis. Kaposi sarcoma, it's like something which is a cancer of the skin, which is in normal person, it's a self-limited disease. But in the AIDS patient, due to the breakdown of the immune system, it proliferates all over the body and it needs treatment. When we give this patient therapy, and if there is an effective therapy or not, that is something which we are going to talk about in the next few minutes. Actually, we have now a cocktail which is used, it's 3 drug combinations, which is used to prevent or to attack the proliferation of the virus and to reduce its proliferation in blood, the virus disappears from the blood at all, even through the analysis. And when we do the PCR, which is the test to detect the amount of the virus in the body, we find that we cannot detect the virus even when this amount is just 5 copies per microliter. So this is an achievement. I found that this is an achievement. The immune system returns to health back, and the CD4 or the T helper cells, which is the target of the immune system and which is the maestro, the conductor of the immune system, which the AIDS virus attacks, regains again to its healthy and to its count, and the patient moves to his normal or her normal life again. The problem here is that this drug is a very expensive drug. This combination of drugs is a very expensive drug. It needs around $1,000 per month. And now it's being taken for life. We don't know what's going on to occur tomorrow, but right now it's being taken for life. So nobody can afford to take this. And if he stops these drugs, he might die within 1 month after its stopping. So when we start this treatment, we have to have in mind something to maintain the source of medications for this patient. The patient, the AIDS patient actually suffers from a lot of things, but the main thing is to protect the immune system and to regain its healthy status and to prevent the virus from proliferation. Other opportunistic infections or sarcoma or Kaposi or anything else could be treated well. Even the appetite of the AIDS patient becomes improved and he returns back to normal. Does the AIDS patient could fast, or could the AIDS patient fast? Actually, yes. There is a lot of new medications which we can give the patient in a single or double dose per day. 4 years ago, this patient could take around 15 pills per day to maintain his medications. Now it is just 3 or 4 pills per day, and they are taken in 2 doses, could be divided 12 hours or something like that. And the AIDS patient actually could fast, but under the supervision of his physician and according to his status, health status, and according to the manifestations which appears through the whole body. And there is an important thing that the spiritual aspect of Ramadan gives a boost for the immune system to regain its healthy status again. And actually Ramadan reminds us with something which God told us, that a single faithful partner is something which protects ourselves from getting a lot of diseases through sexual intercourse, which is actually right now count for 40 diseases could be transmitted through sexual intercourse or random sexual intercourse with multiple sex partners. Also, negligence is one of the factors which spread AIDS through non-sterilizing the medical equipments and non-checking the blood and blood components. And this is a very important issue which we should be careful about, because this is a life of a patient or his death.